Hello, students, and welcome to chapter 17, part 4. We are talking about patients with allergies and immunity conditions, and now we're going to focus on human immunodeficiency virus HIV infection. This is going to be a little bit a long video, okay? So let's start with a YouTube video to better understand the condition and to get into the topic. Okay, here we go. Let's watch this video.
HIV is the human immunodeficiency virus. If you have HIV, you have an infection that damages your immune system over time and causes AIDS. AIDS stands for Acquired Immunodeficiency Syndrome. It is the final stage of an HIV infection when your immune system is damaged and too weak to fight off ordinary infections. When foreign invaders, such as bacteria and viruses, get into your body, they can cause infections. These events activate your body's defenses. The white blood cells of your immune system are part of your body's defenses. One type of white blood cell, called helper T lymphocytes, or helper T cells, strengthen your immune system's response to infection in two ways. First, helper T cells release chemicals that attract other white blood cells to the site of the infection. These additional white blood cells attack the invading bacteria or virus, as well as other infected cells. Second, helper T cells release chemicals that cause other white blood cells to multiply. These new white blood cells create markers, called antibodies, which can identify the same foreign invader throughout your body. Antibodies attach to the bacteria or virus, marking them as targets for your immune system to destroy them. If you have HIV, it travels through your blood and other body fluids to infect and kill certain white blood cells. The virus enters helper T cells, which are the primary target. Once inside, the virus makes many copies of itself. As these virus particles are made, they leave the damaged helper T cell to infect other cells. The T cell loses its ability to protect the body from the ongoing infection and dies. In this way, HIV spreads and kills more of your helper T cells, weakening your immune system. As a result, other types of infections are able to take advantage of your body's inability to defend itself. These infections are called opportunistic infections. If you have an HIV infection and one or more opportunistic infections, you have AIDS. Some of the common AIDS-related opportunistic infections are inflammation of the tissues covering your brain and spinal cord, called meningitis, inflammation of your brain, called encephalitis, respiratory illnesses, such as pneumonia and tuberculosis, intestinal illnesses, such as chronic diarrhea caused by infectious parasites, and cancers, such as Kaposi's sarcoma and non-Hodgkin lymphoma. HIV passes from person to person through infected body fluids. HIV can enter your body during unprotected sex, while sharing drug injection needles, during your own childbirth, while breastfeeding from your mother, or from contaminated blood or blood products. Although there is no cure for HIV, drugs called antiretroviral medications can reduce the amount of HIV in your body. One class of antiretroviral medication, called entry or fusion inhibitors, disrupts the HIV infection process by preventing the virus from attaching to your cells. Other classes of antiretroviral medications include reverse transcriptase inhibitors, protease inhibitors, and integrase inhibitors. These drugs prevent the creation, assembly, and spread of new viruses. Your doctor may prescribe a combination of these drug classes known as highly active antiretroviral therapy, or HAART. Antiretroviral medication doesn't completely remove HIV from your body, but slows it down enough to enable your immune system to fight infections. Regular blood tests will let your doctor know how effective your antiretroviral medication is in controlling HIV. If the number of helper T cells is high enough in your blood sample, your medication is working. Treatments for the opportunistic infections of AIDS are medications specific for each type of infection. For example, your doctor may prescribe antibiotics if you have pneumonia or tuberculosis. To avoid getting or spreading an HIV infection, know your HIV status and your partner's status by getting tested regularly. The most effective way to prevent HIV infection is to avoid vaginal and anal sex. When engaging in sexual activity, you will be less likely to contract HIV if you only have sex with one uninfected partner or use latex condoms for protection. Avoid using injectable illegal drugs or sharing drug needles because the needles may have the virus on them. Avoid intoxication from drugs or alcohol because you will be more likely to engage in unsafe sexual behavior.
Thank you so much. What a great introductory video. Excellent video. So right now that we have an idea of the whole disease, and also the video referred and spoke about the medications, how they are used, and kind of give a brief summary of the stages of HIV and patient education. It was a great video. Okay, let me explain this condition in more detail. Okay, so this is the virus, okay, and the continuum of HIV disease has 3 identified stages. Stage 1, which is acute HIV infection, stage 2, chronic, and stage 3, acquired immunodeficiency syndrome. Okay, so in the video we learned that if you have HIV and at least one opportunistic infection, that is considered AIDS, your stage 3, right? Stage 1 begins with the onset of the acute infection responses after initial infection by the virus. This stage is relatively short, and in most infected adults can progress over time to stage 2. With current drug therapy, stage 2 can be treated as a chronic disorder. The final and most serious stage 3, known as AIDS, is characterized by a profound reduction of immunity, and in this case your T cells, right, with poor protection against infection and increased risk for cancer development. So in stage 1, the reaction is going to appear within 4 weeks of first being infected, and you're going to have fever, sore throat, rash, night sweat, chills, headache, and muscle ache, similar to those of any viral infection. That's why sometimes this stage 1 is misdiagnosed, right? Especially in this early acute phase of the disease, the viral numbers in the bloodstream and genital tract are high, and sexual transmission is possible, right? So then when HIV results from a single sexual encounter, progression takes longer. Personal factors influencing time to progression include frequency of re-exposure to HIV, presence of other sexual transmitted infection, nutrition status, and stress. And this paragraph is very important. So when HIV results from a single sexual encounter, progression takes longer. A single sexual encounter, progression takes longer. Personal factors influencing time to progression include frequency of re-exposure to HIV, presence of other sexually transmitted infections, nutrition status, and stress. So that's good to know. Progression could be fast or slow depending on these factors. During stage 2, following seroconversion, drug therapy started in this stage suppresses viral reproduction. So in stage 2, the medications are going to suppress viral reproduction. Always remember that this condition does not have cure. So with the medications, we are going to slow the progression of the condition. During stage 2, HIV RNA quantification laboratory test, also known as HIV viral load test, may be performed. And that's the key. We have to double check how bad or how is the viral load in order for the doctor to change the medication or to diagnose and classify HIV in the corresponding stage. Okay, viral load. So this test is more accurate than any other in determining the course of the disorder, including the test for CD4 T cell counts. And it's all about the CD4 T cell count. Okay, it's all about the CD4 T cell counts. HIV RNA quantification tests provide a basis for prognosis, disease progression, and response to antiviral treatment. As drug therapy only suppresses viral reproduction and does not actually kill the organism, right? Eventually, some patients progresses to stage 3. So we need to understand that. The count decreases, and those that remain function poorly. Poor CD4 T cell function leads to these immunity abnormalities. So poor CD4 T cell function leads to these immunity abnormalities. Leukopenia, right? Decreased numbers in WBC. Lymphocytopenia, so decreased numbers in lymphocytes, right? Production of incomplete and non-functional antibodies, and that's, I think, is a big problem when you don't have your antibodies non-functional 100%. Abnormally functioning macrophages. So macrophages are the one that engulf all the bad soldiers that enter in our system. Okay, so a diagnosis of stage 3 requires that the adult be HIV positive and have either CD4 T cell count of less than 200. That's good to know. Please remember CD4 T cell count less than 200 is your marker for stage 3. Okay, so stage 1, remember your flu-like symptoms, and in stage 3, the count of CD4 T cells is going to be less than 200. Okay, and also when you have these and certain opportunistic infections, you also will be diagnosed with AIDS. Okay. So some opportunistic infections is, for example, Candida albicans is a normal part of oral and vaginal flora. When the immune system is working well, the organism is present in controlled areas and amounts and does not cause infection symptoms. The profoundly reduced immunity in the adult in stage 3 allows usual harmless organisms such as Candida to overgrow and cause symptoms infections, right? So also we need to know you are having the patient with stage 3 is a risk for more conditions, like they are coming from bacterial, fungal, or viral origin, right? And opportunistic cancers. The most common opportunistic infections include candidiasis, cryptococcosis, cytomegalovirus, Mycobacterium avium complex, pneumonitis, Girovecci pneumonia. I think this is the most common. Toxoplasmosis and tuberculosis, right? And the most common cancers, as we saw in the video, are Kaposi sarcoma, especially in stage 3, certain types of non-Hodgkin lymphomas, and invasive cervical cancer. Okay, that's good to know as well. Also remember that everyone who has a stage 3 infection with HIV, but not everyone with HIV infection has progressed to a stage 3. Again, remember that everyone who has a stage 3 infection has HIV infection, but not everyone who has HIV has progressed to a stage 3. The distinction is made by the number of CD4 T cells and whether any opportunistic infection has occurred. And right now, HIV is a condition that people can live with, okay? It's not fatal as long as you treat you take your medications and you follow up the doctor's recommendation, right? I know, in fact, a celebrity in my country who is living with HIV and is completely, it looks fine on TV, right, for more than 25 years. So he's follow up on his appointments, taking the medication, and he is doing well, very well. Okay, so examples of opportunistic infections, AIDS defining conditions. This is on stage 3. All the conditions that we mentioned before, from candidiasis all the way to tuberculosis, especially Kaposi sarcoma and pneumocystis, Girovecci pneumonia. There you go. So what is cryptococcosis? Okay, it's a potentially fatal fungal infection of male in the lungs presenting as pneumonia and brain, where it appears as a meningitis. And then the cytomegalovirus, I'm sure you heard about this, is from the herpes family and can be spread through contact with body fluids such as saliva, urine, blood, semen, and breast milk. It can also be transmitted from mother to baby during pregnancy or childbirth. There is no cure for cytomegalovirus. Okay, so okay, important fact here in the older adult health: HIV risk in older adults. Infection can occur at any age. Assess older adults for risky behaviors, including a sexual and drug use history. Age-related reduced immunity increases the likelihood that the older adult will develop the infection after an HIV exposure. And I want to make a parenthesis here, and this is happening, okay? Especially you nurses that are going to work in nursing home, okay? These older adults are, engaged in sexual activities, okay, in the nursing home. So your responsibility is to monitor and to assess that they are HIV free. Okay, pathophysiology review. The cause of HIV infection is important to identify. It can be transmitted through sexual contact, via sharing needles, through perinatal exposure. We knew that. We saw in the video. HIV is a type of retrovirus, which is a family of viruses that use RNA as their genetic material instead of DNA. Actually, they invade our cells that are having DNA, and they take our DNA, and with that DNA, they start reproducing, right? These viruses can insert their RNA into our human cells' DNA, yes, with the enzyme reverse transcriptase to exert control over the human cells' actions, making them very efficient at infecting host cells. Okay, so the HIV life cycle here, I'm not going to test you on this, but I want you to understand also, I'm not going to test you on the each stage of the HIV, but you need to understand the relationship between the life cycle and the medications. And because the medications are going to address specific stages in related to how the virus multiplies. So for example, we have the process of HIV infection. Its life cycle takes place in 7 stages. Okay, 7 stages. Remember that in the video they are mentioning different types of medications, and those medications are related somehow to these 7 stages. For example, in stage 1 is called the binding. HIV binds, attach itself to receptors on the surface of CD4 cells, our T cells, right? And then you have a stage 2 fusion. The HMB envelope and CD4 cell membrane fuse together, allowing the HIV to enter the CD4 cell. In stage 3, reverse transcription, the HIV release and uses the reverse transcriptase, that HIV enzyme, to convert HIV RNA into HIV DNA. And stage 4, the integration. This virus releases integrase, another HIV enzyme, right, into the CD4 cell nucleus and inserts its own DNA into the DNA of the CD4 cell. Now in stage 5, replication, 6, assembly, and 7, booting. This newly formed non-infectious type of HIV pushes out from the CD cell and releases protease, another enzyme. This enzyme breaks up the protein chains into the immature virus, which creates the mature form of the virus. So this virus has multiple enzymes that are somehow controlling our cell and taking our DNA to use it and multiply. These steps are important to understand as different types of drug therapies that treat HIV interrupt it. Exactly. That's very important to understand, okay? And we are not going to get into the subtypes, and this is important also. The genetics, genomics, long-term non-suppressors, the LTMP, long-term non-progressors, long-term non-progressors. Remember that. We're going to talk about this later. A small population of people with HIV are called long-term non-progressors. Like, I'm assuming is the same as the celebrity I know. These individuals, although infected, remain asymptomatic with normal CD4 counts. So they are asymptomatic with normal CD4 counts indefinitely without taking antiretroviral therapy. So another word that I want you to remember is the antiretroviral therapy. So they are asymptomatic, normal CD, without taking medications. Okay, so several genetic markers have been found in these long-term non-progressors, including certain human leukocyte antigen, HLA, class 1 molecules, and select chemokine receptors that may explain why these individuals do not develop HIV symptoms. So in these people with long-term non-progressors, they found this HLA class 1, right, human leukocyte antigen, and these select chemokine receptors. And it looks like the appearance, the presence of these participants explain why these individuals do not develop HIV symptoms. Research continues to determine further genetic implications associated with this population. Please be certain to remind patients that as long as viral levels are detectable, HIV can still be transmitted to others. That's a very important statement, because at the beginning of the condition, maybe the viral load is not going to be searchable in the blood work. Okay, you have to wait certain amount of weeks after being exposed to the virus. So remember that patients that as long as viral levels are detectable, okay, HIV can still be transmitted to others. And here, if I were you, I will take a picture of this graphic, and I will just make a I don't know, like a special card to keep it with me all the time if you're gonna work on a institution or any place where HIV is gonna be treated. So you see, this is the HIV life cycle, medicines in 7 drug classes. You're going to see the stop sign, right? And also they are describing the HIV at different stages. So in the biting stage, which is stage 1, where you see the stop sign, is because they are using the CCR5 antagonist and post-attachment inhibitors, you see, especially for that particular stage. In the fusion stage, they are going to use fusion inhibitors. In the reverse transcription, which is stage 3, they are going to use non-nucleoside reverse transcriptase inhibitors and nucleoside reverse transcriptase inhibitors also. So, and you can keep going reviewing these stages and the medication use on each stage. Incidence and prevalence in 2022, about 1.2 million people in the US were estimated to have HIV, with 13% of them unaware of being infected. So it's almost 120,000 people, right? It's 13, probably to almost 200,000 people out of that 1.2 million. They didn't know they were infected, right? HIV disproportionately affects individuals who are Black, African American, Hispanic, Latino, and multi-races, and gay, bisexual, and other men who have sex with men. Another important factor, you have to teach all adults to use protection during any type of sexual activity, and to never share needles or syringes to decrease the risk for contracting HIV. That's good to know. Is patient education. As I always tell you, any information related to patient education and safety is coming in NCLEX. Health promotion and disease prevention. You have to teach people with HIV that is found in all body fluids of infected patients, and therefore direct exposure to another person's fluids increase the risk of transmission. Blood, semen, vaginal secretions, and breast milk have the highest HIV concentration. Safety, NCLEX alert, so sexuality, parentally, and perinatally. Okay, so another teaching portion is remind people with HIV that the HIV is not transmitted by casual contact in the home, school, or workplace. This is very important because many patients they have a misinformation, right? They need education, especially family members. Sharing household utensils, towels, and linens, and toilet facilities that not transmit the HIV virus, unless there is breakdown in the skin, right? And you can see blood. HIV is not spread by mosquito or other insects. The risk for transmission is low if someone is splashed with a body fluid, or if the fluid makes contact with the intact skin or mucous membrane, even if blood is present. The risk for transmission is low. Where the book is telling you the risk for transmission is low, even if blood is present, right? I will take my personal precautions in that. But this NCLEX alert, okay? Now, sexual transmission, the risk for becoming infected from a partner who is HIV positive is always present, even when safer sexual practices are observed. Some sexual practices are riskier than others. We know that, right? Because the virus concentrates in blood, seminal fluid, and vaginal secretions. Risk differs by sex, sexual act, and the viral load of the infected partner. Okay, so avoid risky sexual activities. Another important box related to gender health. This is an NCLEX alert. HIV is transmitted from an infected male to an uninfected female when infected body fluids come into contact with mucous membranes or non-intact skin. Again, mucous membranes are non-intact skin. A vagina has a graded mucous membrane surface area compared with a penile urethra. Teach all people the importance of always using a condom when engaging in any type of sexual activity. And talking about this, anal intercourse in which the penis and seminal fluid of an infected adult inserting or top partner contacts the mucous membrane of an infected partner rectum, receiving or bottom partner, right, has the highest risk for transmission regardless of the receiving partner's sex assigned at birth. So anal intercourse can tear the rectal mucous membrane. Yes, that's the dangerous part in this, right? To break down the mucous membrane, making infection via seminal fluid more likely. So you have to use a new latex or a condom for each individual encounter. Especially if it's genital or anal, change condoms if engaging in one type of intercourse followed by another, and then apply water-based lubricant in addition to use the condom to minimize friction. Place a latex barrier, sometimes called a dental dam, and then use latex gloves when making finger or hand contact with the vagina or rectum. Change gloves when moving sites. And then another important box related to culture and spirituality, sexual activity and condom use. In some cultures, anal intercourse is practiced as a contraceptive method. And we need to be aware of these different cultural practices, right? As nurses, especially in cities where they are the cultural diversity cities, right? Although pregnancy may be prevented, transmission of HIV and other sexually transmitted infection is possible. So you need to advise your patients to use condom regardless of whether intercourse is oral, vaginal, or anal to protect themselves, right? Parental transmission, preventive practices to reduce transmission among individuals who use injectable drugs includes using syringe services programs and teaching people how to clean needles. So if you realize so far, all of these topics are related to patient education, all of this, right? How to practice safe sexual activities, the fact about the needles, right? The use of syringe services program is known to reduce incidence of HIV and hepatitis C by about 50%. These programs, often offered through a pharmacy, provide people with steroid needles and injection paraphernalia without cost and without a prescription. So they also provide information about how to access pre-exposure prophylaxis, your PrEP, right? Pre-exposure prophylaxis, a preventive method in which antiretroviral drugs taken by someone who is HIV negative and at high risk of exposure to the virus, meaning that that person that is not infected probably is going to have a sexual activity with somebody who is infected, how to recognize and respond to a suspected drug overdose, and how to obtain naloxone to be used in case of overdose, right? And people who have had a positive HIV test at any time cannot donate blood. That's important. That's good to know. Okay. It's important to remember that, okay? And also all donated blood in North America is screened for HIV antibody. Pay attention to this because it's very important regardless of the unit you are going to work, okay? You need to know this because some patients that are going to receive blood transfusion, they are going to ask you about this, okay? So all donated blood in North America is screened for HIV antibody, and blood that is positive for HIV antibodies is not transfused. Blood that is positive for HIV is not transfused. Because of the gap in time in antibody production after exposure to HIV, infected blood can test negative for HIV antibodies within this window period. Do you remember I told you after the exposure, probably the viral load is not going to be seen in the blood. There is a window period, right? So here is this statement: because of the gap in time in antibody production after exposure to HIV, infected blood can test negative for HIV antibodies within this window period. Teach patient that there is a very small yet real possibility of transmission of the virus via receipt of blood products. Okay, that's why I'm telling you, extremely important. You need to know this factor to educate your patients, regardless if you're going to work on a HIV unit or clinic or, okay. So box 17.9, patient and family education, how to clean syringes. You can go deep on it, read this. And follow, the instructions step by step on how to clean the syringes. Also, let's talk right now about the pre-exposure prophylactic PrEP. Provide education about pre-exposure prophylactic PrEP to people who are HIV negative. This practice involves the person who is HIV negative yet at risk for HIV infection taking antiretroviral drugs before sexual activity or drug injection to avoid infection. So it's before sexual activity. So the uninfected person is taking the drug before sexual activity with that infected patient, right? So when used as prescribed, PrEP reduces the risk of contracting HIV from sex by about 99%. So it's kind of real effective. Okay, so now let's talk about cabotegravir. This is a medication used for PrEP. So we were talking prophylactic, right? Prophylactic, pre-exposure, prophylaxis, PrEP, pre-exposure, prophylaxis, PrEP, right? So this is cabotegravir, a medication used for this purpose, can be taken orally or given by injection. Tenofovir disoproxil fumaramate entrisably, whatever, can be prescribed for all people, whether tenofovir, alafenamide, emtricitabine is approved for sexually active men and transgender women. Okay, so tenofovir has two types, right? One is prescribed for all people, okay, and the other one is prescribed for sexually active men and transgender women. Both of these combination drugs have a U.S. Food and Drug Administration black box warning. Both of tenofovir have a black box warning, stating that they should not be used in patients who are infected with hepatitis B virus because severe acute exacerbation of Hep B have occurred when patients have stopped using this drug for PrEP. So this is a drug alert black box. In the case of tenofovir, always you ask if you're having any history of Hep B or any active Hep B, okay, because it's going to produce a severe acute exacerbation of Hep B in these patients, okay. So that is in the case of tenofovir, okay, also known as cabotegravir. Okay, So now we are moving to another safety box. Remind adults taking PrEP or TASP. Okay, TASP is a treatment as prevention to use the safer sex practices described previously and to adhere to any every 3 months HIV testing. So regardless, even because some patients, they are gonna tell you, oh, I was taking my PrEP drug, so I had sex with this HIV patient and I don't think I got the virus because I took the PrEP. No, you still need to have safer sex practices, okay? And you need to be evaluated every 3 months and have an HIV testing because of that window period, right, that we were talking before. So that's good to know. NCLEX alert. Let's talk about post-exposure prophylaxis, your PEP. So another method of preventing infection in a person who is HIV negative is known as post-exposure. And this is only to be used in emergency situations after a potential exposure to HIV, and is not recommended for frequent use. Okay, so it's after exposure of HIV. Teach people to contact their PCP if exposure is non-occupational, right? Or their employee health division if exposure happened occupationally, meaning that you had, as a nurse, you have contact with somebody HIV positive fluids, right? Immediately, if they think they have exposed to HIV, treatment use as NPEP or PEP must be started within 72 hours. That's the most important part. If you had contact with blood or any fluid of an infected patient, you need the PEP to be started within 72 hours, within 3 days, right, of possible exposure, and early is better, even as soon as 2 hours following exposure. So as soon as 2 hours following exposure, and the latest is 72. It is taken for 28 days, right? Pre-testing and post-testing for HIV status is necessary to determine whether PEP was effective. Okay, so drugs used for PEP include tenofovir and entristabine plus raltegravir or dolutegravir. Okay, so most important to remember in terms of PEP, you have immediately after the exposure, right? As soon as 2 hours, start your medication, and within 72 hours, and you need to take medication for 28 days. Treatment as prevention. So provide education to patients with HIV positive about treatment as prevention, which is the practice of taking the medication to prevent sexual transmission to others who are HIV negative. So engaging in TASP, your treatment as prevention, can help the HIV positive individual maintain an undetectable viral load. Again, engaging in TASP can help the HIV positive individual maintain an undetectable viral load, which greatly reduces the risk from transmitting the virus to an infected person. So let's clarify this. When the viral load is present is when more risk of transmission is, right? As long as you have undetectable viral load, greatly reduces the risk from transmitting the virus to an infected person. Okay, remind patients that TASP does not replace safer sexual behavior described early in this chapter, which should consistently be followed. So as soon as you know you had contact with somebody with HIV, you have to follow your testing every 3 months, right? Or as your doctor recommends. Okay, you need to follow up. Let's say on the first test is the viral load is not detectable, and you are going to, if the patient is going to believe, no, I don't have HIV. That's not true. You need to come back every 3 months, right, and make sure, after a couple of tests, that the virus is not there. Okay, so Another safety priority to prevent HIV transmission to patients. Healthcare workers must wear gloves when in contact with patients. Your standard precautions, especially contact with patient mucous membranes or non-intact skin, meaning any breakdown in the skin. Infected workers with weeping dermatitis or open lesions must wear gloves or not perform direct patient care. Okay, this is a safety alert, NCLEX alert. So another safety priority, the best mode of prevention of HIV transmission to healthcare professional is the consistent use of standard precautions, as I just mentioned, for all patients as recommended by the CDC and required by the Joint Commission. Remember that even though the risk for contracting occupational transmitted HIV is low for the healthcare professional who experiences a body fluid splash or needle stick, standard precautions must always still be used. Okay, so let's stop here, and when we come back we are going to start, because remember we just review the definition of the condition, the stages, right? The PrEP, which is your pre-exposure precaution, drugs, and also your post-exposure, and also a lot of patient education, right? So right now we are going to focus in the following video about the assessment and the opportunistic infections and much more. So let's stop here. This is HIV. Is very important. This is a condition that is almost 1.5 million people that is being treated in United States, and there is a high percentage of individuals that they don't know they have the condition. So we need to focus on this, and the fact that the condition is not does not have a cure, and there are different presentations, and we have patients that are not really presenting the viral load in the blood. It requires us to be aware and to to have full knowledge about the disease. So let's stop here. When we come back, we're going to start reviewing the assessment and everything else. Thank you.